Okay, so we want to introduce ourselves first. My name is Moody, and I am an athletic trainer here at the University of Montana.
And my name is Mitch Willert. I'm also an athletic trainer here at the University of Montana.
And we were asked through Molly Blair of New Directions to put together a presentation about sport-related concussion in support of their work for a grant they received from the Craig Nielsen Foundation.
All right, so to start off, first, what is a concussion? Concussion is a mild traumatic brain injury resulting from the rapid acceleration or deceleration of the brain tissue within the skull. So one thing I like to use as an analogy is simple physics, as far as an object in motion tends to stay in motion unless acted upon by an outside force. Just think of we're driving down the street in a car and a dog runs out in front of us. We have to slam on our brakes. Our bodies continue to move forward until we hit that seatbelt. And then if you think of that in our brain continues to move even when our skull stops. So then our brain has to hit the skull and then it rebounds. And that's when we have that rapid acceleration or deceleration. And this causes a change in shape that can stretch the tissue and ultimately damage the brain cells. This damage also can occur and cause a chemical and energy change within the brain cells, which makes it more difficult for the cells to work and operate.
So when we think about how concussions occur, they don't always occur in a typical fashion when you think of getting hit on the head or bonking your head. We see pretty commonly in motor vehicle accidents that concussions occur. Often what Mitch described is through a whiplash injury. Falling is another common mechanism for individuals to sustain injuries, military blast injuries, but often in sports, we see them either from a direct blow to the head or from that whiplash-like injury. So again, if you're moving forward and you are abruptly stopped by an object or a wall, in hockey we think of the boards, then that can create a shaking of the brain within the skull itself, creating injury.
All right, so just a couple of fun facts. So Montana itself ranks second in traumatic brain injuries per capita in the U.S. And the CDC estimates there's about 3.8 million concussions, but we do know that fewer than half of concussions are actually reported. So that 3.8 million could be very close, or it could be very far off of what is actually happening. And recovery ranges anywhere from 2 to 4 weeks, sometimes can be longer or shorter depending on the situation.
So one thing we want to focus on is just making sure that you're comfortable recognizing signs of concussion. And besides a headache or feeling dizzy, a lot of times there's other symptoms that may present themselves that you may not be aware of right away or recognize as symptoms of a head injury. So a lot of the symptoms tend to fall within just trouble concentrating. So if you're in school or reading or doing work, you're not able to focus on those efforts as well as you usually can. You're having trouble remembering things, you feel foggy. The other aspect that people don't think about as much is just sleep. So if your sleep patterns are disrupted, you're either sleeping too much or too little out of what your normal routine is, that can also be a sign of concussion. And then lastly, just being more emotional than usual and feeling irritable, more sad, anxious, and angry. These are symptoms that can arise as a result of a head injury and can also persist for longer periods of time.
Okay, so you suspect a concussion, now what are you supposed to do? The first thing is don't hide it. If you suspect someone has a concussion or if you suspect you yourself have one, report it to someone so that you can get the proper help. Remove yourself or remove that person from the situation or from play, whatever activity it may be, and then seek medical attention. If you can report any history of concussions, if you know about any, that's going to be important. And most importantly, when it comes to the recovery, you have to allow adequate time. Like we said before, these recoveries can take 2 to 4 weeks, sometimes longer, sometimes shorter, depending on each person's recovery. But allowing adequate time is crucial to the recovery.
I want to provide you with some home care instructions, just because some of these things have changed over the past few years. Historically, individuals with head injuries were told to stay in a dark room and basically not do anything right after the injury itself. So we've moved away from that. You don't need to stay in a dark room. We want your routine to be as normal as possible, as long as it doesn't make your symptoms worse. So you don't need to make sure that you're really disrupting your schedule too much. You don't want to, typically if you take an hour-long nap, you don't want to be napping for 4 or 5 hours at a time. Making sure that you are avoiding alcohol use, but a good diet and good hydration can help facilitate your recovery. Screen time, so if you're on your phone or computer quite a bit, it's okay to be on that as long as it's not making your symptoms worse. And then at least initially, if you need to take medication, stick to Tylenol, at least early on, and then consult with a medical provider before making any decisions to change up your medications. And the last thing is just concussion is not necessarily a structural injury. It's a chemical change that Mitch described. So oftentimes you don't need to have an MRI. But again, that's something you want to make sure you're discussing with your medical provider to help make those decisions.
All right, so when do we start this December to do the activity in the protocol? First, we want to have a brief 24 to 48 hour rest period. And that's exactly what Val just described, not doing certain activities or putting yourself into situations that increase your symptoms. After that first 24 to 48 hours, then we can work our way back into cognitive and physical activity. But generally speaking, we want to get to the point where we're 24 hours symptom-free prior to working our way into our step-by-step process or our step-by-step protocol that we'll show next.
Yeah, so once you become symptom-free and you're ready to return back to your activity in a safe manner and you've received some medical advice on how best to do that, this is just an example of what that might look like. So we don't put you right back in full swing. We do make sure we take appropriate steps to gradually work you back into your activity fully. And so it's important to just recognize that there's a process. You don't need to memorize the process, but you certainly want to be working with a provider or professional that can help guide you through this process safely so that you do have a full return to your activity in a timely manner and keeps you safe all the while.
All right, so some key take-home points for today. Most important, don't hide a concussion. It can take way longer to recover or become more serious as you continue to do your activities if you hide it. If you suspect a concussion, remove that person or remove yourself from the activity. Seek appropriate medical treatment following any situation where you suspect a concussion. Allow adequate time to recover, and then return to school before you return to play. We want to introduce you back into normal activities of daily living before getting back to those additional activities such as sport or play.
Thank you for listening to our presentation. We want to make sure you have a good, fun, safe summer. Get outside and enjoy everything that Montana has to offer. And our contact information is below if you have any questions or just like more information about concussions and keeping you safe and active. Thank you.